Hello everyone, I am Shahan. Welcome back to my YouTube channel Medico Shahan. And in this video we will be discussing about DIC, that is Disseminated Intravascular Coagulation. We are in the middle of 100 days 100 disease series where every day I discuss about a new disease. And today our topic is DIC. DIC means Disseminated Intravascular Coagulation, also called DIC. So let us learn about the definition of DIC. DIC, also called defibrillation syndrome, also known as consumption coagulopathy, is a complex thrombohemorrhagic disorder, and it occurs as a secondary complication to some systemic disease. So what is DIC? Basically, it is a secondary complication of a systemic disease, and in this disease we have defibrillation syndrome. We have defibrillation. So fibrins are broken down. So defibrillation syndrome, and also known as consumption coagulopathy. So it is a coagulopathy. Coagulation takes place by consumption of the clotting factors. So that is why it is known as consumption coagulopathy, and it causes thrombohemorrhagic disorder. So it is a thrombohemorrhagic disorder. That means it has thrombus formation and hemorrhage also you can see. So both thrombus formation and hemorrhage, both are there. That is why it is known as thrombohemorrhagic disorder. So once again, let us learn about the definition. So DIC is defibrillation syndrome where fibrins are broken down, consumption coagulopathy where consumption of the clotting factors happens, and coagulopathy, coagulation takes place, is a complex thrombohemorrhagic disorder. That means it is a complex procedure where thrombus formation occurs. Along with that, you will also get hemorrhage. So you will also get hemorrhage. So thrombohemorrhagic disorder, and it manifests as a secondary complication of some systemic disease. So it is found as a secondary complication of some systemic disease. Now let us learn about etiology. You have four important etiology: massive tissue injury, infection, widespread endothelial damage, and miscellaneous. So let us learn one by one. Massive tissue injury. In massive tissue injury, we have some gynecological and obstetrics problem like abruptia placenta, amniotic fluid embolism, we have metastasis, we have surgery, we have trauma. All these cause massive tissue injury, and this massive tissue injury can cause DIC. Next is infection. So we have endotoxemia, endotoxins when increased in the blood. So we can get this from meningococcal infection, gram-negative meningococcal septicemia, and other viral infection. So all these can cause infection, and these infections can lead to DIC. Next is widespread endothelial damage. In widespread endothelium damage, for example in aortic aneurysm or HUS or severe burn or acute glomerulonephritis GN, you can get the widespread and endothelium damage, and that can also cause DIC. Next is miscellaneous. It can be caused by snake bite, shock, heat shock, and AIH. So all these can cause, like massive tissue injury can cause DIC, infection can cause DIC, widespread endothelial damage can cause DIC, and miscellaneous cause like snake bite and shock can cause DIC. Now what is the pathogenesis? How this disease is caused? First, activation of coagulation. First, number one stage, the coagulation procedure, the coagulation pathway is activated. Second stage, thrombotic phase. In thrombotic phase, as the coagulation pathway has been activated, so the clotting factors will produce thrombus. So thrombotic phase. Third is consumption phase. In consumption phase, all the clotting factors that are needed for formation of thrombus, this has been consumed. So consumption phase. Number 4 is secondary fibrinolysis. As fibrin has been deposited in making the thrombus, so secondary fibrinolysis occur. This is a procedure. Fibrinolysis means a process by which fibrins are broken down. So fibrin will be broken down and there will be lot of FDP. What is FDP? Fibrin degradation product. Fibrin degradation product will be increased in the blood. So all these things will happen step by step. First step, activation of coagulation factor. Second step, thrombotic phase, where thrombus are formed. Third step, consumption phase, where the coagulation factor and the clotting factors are consumed. And fourth stage is secondary fibrinolysis stage, where fibrins are broken down and fibrin degradation product are increased. That is, FDP is increased. Next is clinical features. Basically, what is the clinical manifestation of DIC? The clinical manifestation of DIC are two important things. One is bleeding, which is the most common clinical manifestation of DIC, bleeding, and second is the organ damage. Second is organ damage. So these two are clinical manifestation. Bleeding, the most common, and second is the organ damage. In organ damage, it is actually, the organ damage is actually caused due to ischemia. And this actually caused due to widespread intravascular thrombosis, such as in kidney or in brain. You can get this damage. So organ damage can be found in kidney and brain. So what are the lab findings we can get? The laboratory findings which we can get is platelet factors. The platelets are decreased in number, so you'll have low platelet count. Next is formation of cystocytes and fragmented RBC. So it will show like the characteristic features of the hemolytic anemias and all these things. So you will get cystocytes and fragmented RBC. Next is prothrombin time and the thrombin time. All these has been increased. Next is plasma fibrinogen level. The fibrinogen level is also decreased. And at last, the FDP, that is fibrin degradation product, will be increased in the blood. So all these are the lab manifestation of DIC. So this is the end of this video. If you like this video, make a thumbs up and subscribe our channel for getting many more videos like this. Thank you so much for watching.